Hello, my name is Safeera Hussainy. Today's session will provide some insights on pharmacists supporting patients to self-manage common ailments. I work as a research manager at a cancer centre, and my area of interest for nearly 2 decades has been women's health and sexual and reproductive health. The focus of my research has been to identify and close evidence practice gaps through knowledge translation activities in relation to the provision of contraception, specifically emergency contraception, and medical abortifacients in community pharmacy. This includes expert reviewing professional practice guidelines, advocacy activities, delivering education for pharmacists, and raising awareness amongst the general public. I'm currently investigating the sexual health and well-being of people with cancer. This is one of the most distressing symptoms experienced during and after cancer. Supporting patients and health professionals to have these conversations as part of optimal care is the aim of my emerging work in this area. Sexual health is an important part of well-being for every person, irrespective of their gender. Yet most healthcare professionals, including pharmacists, shy away from having these conversations proactively. To be truly supportive, pharmacists can do a number of things. 1. Make it known to the general public that health services offered are inclusive of sexual health. This can be done through signage and promoting campaigns, and that they are offered by trained and friendly pharmacists. 2. Offer to have conversations in a respectful, discreet, and empathetic manner. This includes offering a private space for conversations and using statements that are not stigmatizing or judgmental. 3. Recognize opportune moments to discuss sexual health concerns or risks. For example, in response to a product request, such as emergency contraception, a pregnancy test, or when prescriptions for medical abortifacients or medicines for erectile dysfunction are dispensed. This is a good time to flag symptoms of sexually transmissible infections, or STIs, such as itching, burning, blisters, spots, lumps around the genitals. Also, to inquire about HPV vaccination status, organise an STI test in the pharmacy if it's offered, and discuss ongoing contraception options with a plan for referral to a general practitioner. Number 4, when responding to a symptom request, for example, a urinary tract infection or vaginal thrush, taking the time to conduct a thorough history is critical to rule out differential diagnoses and determine potential underlying causes, such as diabetes, requiring referral. Also needing referral are patients who report symptoms such as altered vaginal discharge, penis discharge, pain or burning on urination, symptoms of an STI, which I described earlier, pain or bleeding or during after sex, bleeding between periods or breakthrough bleeding when on contraception, pain in the testicles or lower abdomen. And lastly, number 5, non-pharmacological interventions such as adequate hydration and cotton underwear are important to increase comfort in managing the symptoms, along with non-prescription products such as urinary alkalinizers or thrush creams, pessaries, or tablets. Explaining how to use these step by step is important to their success in the self-management of such problems. So let's walk through a brief case study example. You have a 25-year-old woman who presents with severe itch, no discharge, burning on urination, and there's some blood present in the urine. The symptoms started this morning. She had sex last night and she's taking the oral contraceptive pill. Her adherence is quite good and she hasn't missed any doses. She doesn't have any medical conditions and isn't taking any other medications. Pharmacists can offer a private consultation and organise an immediate referral to the GP given the nature of her symptoms. It's a suspected UTI, possibly an STI, an unlikely thrush given that there's no discharge and the onset and timing of the symptoms. Pharmacists can offer an STI test if it's available. They could also provide a urinary alkalinizer for comfort. The woman should be advised to urinate every time after having sex and using condoms for protection against STIs. A long-acting reversible contraceptive, such as an implant or an IUD, could be recommended if adherence to the oral contraceptive pill poses an issue in the future. It all boils down to interpersonal skills, especially when the problem is so personal as it is in sexual health. A patient will always remember how you made them feel, just like a teacher does to a student. A caring pharmacist who is knowledgeable and has good bedside manner possesses the right skill mix to gain their patient's loyalty. Loyalty is established fairly early on in interaction, in the first minute, and in this time, pharmacists need to focus on greeting with empathy, open-ended questioning, head nodding, and letting the patient tell their story in their own words. Patients can recognise optimal care and will respond accordingly. If they are stressed by the pharmacist's manner or lack trust in what they are saying, they will not listen and will seek another opinion. When pharmacists demonstrate competency through confidence in their recommendations, based on previous success stories with other patients or even themselves, they make it known that the problem at hand that the person is experiencing is common and it can be managed. This makes the patient feel reassured. Recognising one's own limitations is also important. For pharmacists to acknowledge that they don't know the answer or that a referral is necessary further establishes their credibility. Pharmacists need to be agents of change. If they want to see a shift in practice, whether it be expanded scope or public health benefits, they need to have a shared vision amongst co-workers so that everyone's working towards the same goal and feels motivated to make changes, even if they're incremental. If sexual health service delivery is a priority for the team, then implementing a change champion who can lead the organisational change needed is the first step. The change champion could also work with a consumer representative or a community member and take on their feedback to make any adjustments needed to service delivery. Finally, seeking professional development opportunities that are nationally offered and adopting flexible methods such as train the trainer, role play, academic outreach, mentorship, and incentives such as protected time and recognition through leadership of advanced practice roles can help promote a culture of reward associated with development and training.